Hello, everyone. Hello, hello, hello. Hopefully, we're live. We are live. I think we are. All right. How is everybody doing? Let me wait until some people come on in the room. My brother Hostel. How you doing, brother? How are you doing? Well, Sister Sally is back again with us. And I'm just going to give some people an opportunity to come on up in here because our Sister Sally, she have some stuff that she have to get off her chest again today. All right. We're not going to show her face, okay, as usual. All right. But she do have some things that she want to come out and tell our people. Now, does anybody remember the last time Sister Sally was on our channel? Right. I had to block some people. I really had to block some people because people we now I understand that a lot of people have fake accounts on YouTube, social media, whatever, and they may have been, you know, Esau, we don't know, but we did have a couple of people that I had to block because they came in here and they were asking for proof of what Sister Sally was saying. They didn't believe her. They said, "Oh, we need proof. We need some type of stats or whatever." So I was watching this video. Before I bring Miss Sister Sally on, I'm going to share my screen and remind the doubtful among us. Hold on. Let me share my screen for a second. Let me share my screen for a second. Now, before I do that, while you're coming up in here, just hit the like button, please. Please just hit the like button. Hit the like button, share the video, because our people want to see this. They want to see what Sister Sally has to say, because there's some really weird hocus pocus stuff going on in these hospitals. And you want to hear it from the people who are on the inside, okay? Not some hearsay. You want to hear it straight from the horse's mouth. So before I do that, let me share my screen for a second. I'm going to bring Sister Sally on for a minute, but let me share my screen. Hold on. Let me 1 second. Let me share my screen. Okay, there we go. Does anybody remember this young Becky here? Anybody remember young Becky? Right? So the last time we had Sister Sally on, you got some people who was doubting her, didn't believe what she was saying, right? So now, a couple weeks later, we had young Becky saying the same exact thing, right? Now let's listen to young Becky. Hold on. Hold on. You know what? I may have done something wrong. Let me go back and do this again. Let me do this again. I may have done something wrong, guys. I'm sorry. Okay, there we go. All right. Y'all remember this, right?
I don't care because this could save someone's life. I'm a nurse practitioner. I am licensed and certified. I am not on the front lines. I have a friend
You guys hear
in New
it?
York City
I
who's
don't know
on
if
the
y'all
front
can hear
lines.
it.
And for her safety, she cannot come out and say these things. So I am her voice. I'm not going to name
Okay.
names.
I'm not sure if you guys can hear it, but I'm sure most of you guys have seen that video. Most of you guys have seen the video, okay? And that's with that one nurse that was speaking on behalf of another nurse who was pretty much saying the same exact thing that Nurse Sally had said like a month before that, right? And we had our people, well, I don't know if it was our own people, but we had people coming underneath the video um just asking for proof, right? And so, you know, when it comes to our people, if it ain't white, it ain't right, right? It's not right if it ain't white. So uh that white nurse, she came and she validated what Sister Sally told us a month ago, right? That some of us didn't believe. Okay, so we have Sister Sally back today. Now, before I get into that again, I have to say this. Somebody sent me a video today, and before I get into before I bring Sister Sally on, somebody sent me a video today which was very shocking to me, and this is going to tie into a lot of the stuff that's going on into these hospitals. So I'm going to share my screen one more time before I bring Sister Sally on. One more time, because did y'all know, before I share my screen, did y'all know that they are given estrogen, female hormones, to men in the hospitals? Did y'all know that? Yes, they're giving female hormones to the men in these hospitals, claiming that it's going to protect them from the coronavirus. I'm talking about in New York City right now. These things are being tested on young Black men. Okay, now they're not saying that in the news. They're not saying that, but we know that they're claiming that Black people are dying faster from this virus, right? That's the narrative that they're pushing right now, right? So who do you think they're giving this male hormone to, right? So I'm gonna share a video with you guys so you guys can see what it is that I'm talking about here and the depth of these people wickedness. So if you're a Black man and you go to the hospital because somehow you're scared that you might have the virus, right? And so you're sitting there scared out of your mind, and the doctor come in and they say, oh, we have a patch here that is going to protect you from the virus. It's a hormonal patch. And they put it on you, right? Now, listen to this, guys. Listen to this, please. I'm going to share my screen.
So much we don't know about this virus. Researchers around the world continue to study it, hoping to understand how it spreads, whom it affects, and whether we can develop immunity. So here's what we do know. The virus appears to be killing men at a much higher rate than women. At least that's according to some of the limited data we're getting from a handful of countries. But researchers here in the US are now trying to figure out if there's actually some truth to that. So they're conducting a study to determine if estrogen, a female hormone, can reduce the severity of symptoms in men. Well, we're joined now by Dr. Sharon Nachman, an Associate Dean for Research at the Renaissance School of Medicine at Stony Brook University, and also from the same university, Dr. Antonios Gasparis, a Professor of Surgery. Thank you very much to both of you, because I want to talk about this study that is fascinating. Dr. Gasparis, I understand it was your idea, you thinking out of the box. You looked at the gender gaps in the death data particularly, and you had an idea. Tell us about it.
Yeah, it was pretty simple clinical observation. As you mentioned, the gender difference and the severity of disease that occurs between men and women, that's really what triggered everything.
And what was your idea?
Well, it was basically why, the question was why. You know, as you mentioned, about 80%, when you look at the risk of requiring intubation or mortality or death, it's about 80% males versus 20% or 15% in females. So why such a difference? And that led to me trying to see in the literature what do we need.
So if you guys missed that, right? This so-called doctor here is saying that men are dying more than women from this virus. And so in order to stop the men from dying faster than women, let's give them some female hormones to protect them from the virus. Listen to this garbage here.
No. And when you look at the strain of coronavirus that was responsible for COVID, it's a little bit different than what it is for other previous infections, such as SARS. And that gender difference was observed also in SARS. Mm-hmm. Now, when I looked at the literature, what I saw was that some animal studies showed that in female mice, they also had a protective effect. And when there was a block of estrogen in those female mice, that protective effect was gone. So the fate of the female mice was similar to the males. So making that clinical observation that I mentioned earlier, as well as this data that I found, the question was, can estrogen administration give a protective effect to males or postmenopausal women for that matter, to prevent lung progression to require intubation?
So this is fascinating. So I understand that you've enrolled the first patient, putting men on estrogen, this female hormone. Dr. Nachman, tell us about what you're actually doing.
So this study is a randomized study because we don't know if, in fact, it will work. So what we're doing is randomizing patients who are men.
Okay, so they're pretty much just you're just lab rats. They don't know what they're doing. They're randomly just giving men, and we know it's black men. We know it's black men. So they're just giving black men female hormones to turn them into homosexual and female, right? Yeah. And so this is supposed to be protecting them from the coronavirus, even though they have no idea what they're doing. She just said it.
Men over age 18 or women over age 55 in that they're postmenopausal to by chance either get an estrogen patch put on for 7 days or placebo, and to see how they do if they are less hospitalizations for COVID, less admissions to the ICU, and in fact, less intubations.
So with you, Dr. Nachman, just to stick with that, I mean, how do you think estrogen changes the body's immune response to coronavirus? I mean, what are you looking for here? What are you hoping it does to a man's body that it's already seeming to be doing to a female body?
So we hope that it will in fact help their immune response when they see the virus. This amount of a patch, 7 days put on for just once, will not have any feminizing effect on the men who are getting it. It may help the women who are over 55 to feel a bit better when they're postmenopausal, but it will not have any downside feminizing effect for these patients. We do hope that will help protect them against the virus. We are only enrolling people who are symptomatic from the virus, who have positive COVID testing. So we are thinking that everyone who is in the study will in fact have already acquired COVID. So we're hoping it will protect them from progressing from the disease.
It's so fascinating. And Dr. Gasparis as well. I mean, I also understand, and I know I've spoken to a few midwives and obstetricians and many pregnant women, and this has been one of the good things. Many pregnant women, it seems, get a really mild version of corona. And of course, when you're pregnant, your bodies are pumping full of estrogen and progesterone. So do you think that is also an indication that might lead for you to suggest that, hey, there might be something here?
Yeah, I mean, exactly like you're saying. I mean, even though pregnant women can get infected, they get very mild symptoms.
Yeah.
And as they have high estrogen levels, that's just another reason to think that potentially this may have a benefit in protecting you from progressing your disease.
So what are you looking for? And what is your time frame here, Dr. Gasparis?
We're looking to enroll about the first 100 patients first and see, we expect if there's a significant difference, that we will see a trend to that after our first 100 patients, which we hope to get within the next 2-3 months.
Oh, that's quite soon. And you've started, I mean, what do you tell men, Dr. Nachman? You say to them, they're coming in with a cough, that they might have symptoms. How are you convincing them that they need to take female hormones? Is that a problem?
We're not phrasing it. We're not phrasing it, oh, take this female hormone. Yeah. We're telling them that this short time frame of using a patch with a medication called estrogen will in fact help their symptoms perhaps go away. And we are getting up.
So they're lying to them. So you're forcing female hormones on young black men, because we know that's the target, and you're lying to them in the process. You're not telling them, so they don't know what they're getting, right? And they're going to take it because they're scared of dying from corona.
Take from most of the men. I think the young men are perhaps a bit of a harder sell because they are concerned about, are they going to have any downstream effects from the estrogen? But after talking with them for a few minutes, they do recognize this is a serious and significant infection. And in fact, this short-term estrogen patch may help. As you know, because it's a patch, and if there's any side effect from the patch, it's easy to remove, and the levels of estrogen in the body go down relatively quickly. So there is no long-term sequelae from it.
I mean, I know this is also, there's so many doctors like you, researchers, kind of throwing ideas.
And anyway, guys, you guys get the picture, okay? You guys get the picture. I can't even watch that. I'm sorry, I can't even watch that. So there you have it. So if they can't get you with the fear of this virus, if they can't get you to go into the hospital, they're going to get you one way or another. That's pretty much what it is. They can't get you with the contaminated testing that they have, the contaminated mask. It's the reason why they want you walking around in mask, because they know that will lower the immune system and kill you faster than a virus. Okay. they're going to get you one way or another. They certainly will. They certainly will. We're going to bring in our sister, Nurse Sally. Me 1 second. Sister Sally, are you there?
I'm here.
Hey, sis. How you doing,
Hey,
girl?
I'm doing good.
All right, all right, all right. Did you hear that mess?
Yeah, I heard that whole mess.
Goodness,
That
goodness.
is sad. That is so sad. And I think what's even sadder is the fact that no matter how much truth you try to bring to people, they still won't believe. It's almost like the fire is going and nobody believes that it's burning. You know?
Yes, ma'am. Well,
It's
I tell you
sad.
what, if it ain't coming from Whitey, it ain't right.
That's
That's what the
true.
problem is.
That's true. And you know the sad part about it is it's got to be color, you know, for them to understand. And just the fact that, okay, it's too country of a voice. How could she know? What proof do she have? You know, hey, when you working with that, okay, I'm just as healthy and strong as I was when I talked to you the first time. Now,
All praise to the Most High. Sis, I'm glad you're doing good.
I don't see any nurses or any doctors calling in sick, or if anything, we just tired from being on our feet a lot. But I don't see anybody, calling in or saying that they tested positive for this, even though in certain areas I have seen testing centers, and I've even heard from multiple doctors at multiple different hospitals to say concerning this virus, there is no real test that can diagnose this. There is no
Mm,
real test because all kind of virus is a combination of a flu or pneumonia type strand. It's just like when they get the flu vaccine, you don't know which strand you're getting, but you're
right.
just getting a strand of whatever they're giving you behind that syringe. So I myself don't even participate in the vaccinations, period, point blank. Um,
Go.
However, I will say this much though. The thing that gets me with the whole thing since we talked the last time is the trial and error of trying to figure out, okay, so if everybody that's coming in is AKA quote COVID-19, well, let's just look at some of the details of testing that is being done and some of the geographical locations that the actual patients are coming from. For example, I'll use one good example here. Okay, you got a patient that came from let's say, from the nursing home setting. Okay, so you're saying that the patient is diagnosed COVID positive, the reason why they're there. But when I look at the list of what the complaining problem and what brought the patient in, it's just a simple, what we have always considered, maybe flu, pneumonia, or
Just a
something.
regular respiratory condition.
Exactly. So nothing that would indicate, okay, this is what I got. This is what's going on. So to make sure that I'm not off, I'm actually looking at labs. I'm looking at everything that you've done from time that that patient got in. However, when I see that the patient came in and was actually in the hospital for about 10 days, and all of a sudden the 11th day we're intubating, and even at home the patient was not on any kind of supplemental oxygen. Okay, so now what happened during the time that you left the home and you came to the
Mm.
facility? Okay, however, you want to hurry up and get rid of, in one situation of that same
Say it,
situation,
sis. Get rid of, yes.
that they want to send the patient back to the home, but yet you're on the COVID unit saying that that patient is COVID positive. So what evidence
Right.
do you have? Now you're going to send that patient back. You don't want certain, medications. You bought them in to perform whatever test you want to perform, to do whatever practice, because that's what I heard a doctor say to me on multiple occasions, that if you want us to just run tests on you to find out and for us to play around to see what we can do, just come on in, and I'm like,
Hmm.
wow, okay.
Now
So
let me see if I got what you just said correct, sis. I don't know, that may have went over a couple of people's head there. Eh, what you just said, maybe correct me if I'm wrong. Did you just say that somebody comes into the hospital, they're labeled a COVID patient as soon as they come in there, even though their symptoms and whatever illness they have is non-related to COVID, right? So
exactly,
they're labeled a COVID patient, and then after they're labeled a COVID patient, the hospital want to send them back to the nursing home,
exactly.
labeled a COVID. So now they're supposed to have the COVID, but they're being sent back to the nursing home. So isn't that going to put the other people in the nursing home at risk for catching this so-called COVID virus?
Exactly.
Hmm.
And so I had no evidence right on from x-rays to, yeah, x-ray was done. However, it was for the placement of an NG tube, which is what they do in the homes with patients that are not uh, able to eat. They tube feed them. So you have to come to a facility like a hospital that would propagate that particular procedure and
Mhm.
would verify the placement of the tube. You see what I mean?
Right.
So then once it's verified, however, the strangest thing, it's been in there for a few days. Let's just say maybe 5 days. Okay, well, why is he not eating? We got him on a regular diet, but there's no evidence that the speech came around to say, hey, look, we're going to do a swallowing test, or we're going to do this, we're going to do that. But I don't see anywhere in there where it's saying the lungs are this or that. That person is not even on the ventilator. So why would you be labeled COVID-19?
Mm.
What is your purpose? Now, like I said, that's one situation. Now let's go to the situation where we do have the people on the ventilators. Now, my problem is I worked in certain geographical locations where I've seen people like Guardian Health, they airlift people, whether it's West Coast, East Coast, and they're going to send them to a hospital maybe from a remote area that don't have, don't offer certain procedures or what have you. Okay, so when you have a portable ventilator, which is merely a little box, like maybe bigger than the largest iPad. Let's
Mhm.
just say about that size. Okay. And I ran into that several times on the West Coast. And I asked the question, I said, well, what type, you know, machine is this? And it was told to me by the Guardian Health team, which is an airlift team that takes a person from one area to another area. Well, this is for a temporary use, maybe 2, 3, 4 hours, and that's
Right.
it. And it's not for long term. That's why it's so small. Okay, because we can't put the big standard ventilator on the actual plane that we're gonna, or whichever, however the transport method is.
Right.
So they can't do that. So I had a situation where, the patient was like having difficulty breathing, and this person
Mhm.
was actually on a sedative type drug. It was a light sedation, mainly for people that are going to have some type of surgery or something going on. And so the guy literally, it's like he woke up out of, because he was literally having a difficult time breathing. And I can tell he kept pointing at his throat because he did have a trach and he was intubated as well. He was on that particular vent, which was just merely a transporter vent, and so he was pointing to
And
let
now
me know that
let
he
me
couldn't
ask you.
breathe.
Let me just a quick question, sis, for people who don't.
Sure.
So you're saying that the vent that they had him on is not for long-term use,
No.
but the patient is being put on the same vent that
Hmm.
is not meant for long-term use. And
Exactly.
that's what they're using in these hospitals on these patients.
Exactly.
Hmm.
Exactly. And so how I came across that information with them, because I wanted to verify what I had been told previously by Guardian Health. And I wanted to verify that this was the exact same thing that I had already seen. And so I was told, yes, this is the same type ventilator. It's not really for long-term use. This is respiratory talking about it. And so
Mm-hmm.
it's not for long-term use. This is for short-term use. That's the reason why we keep having to change the little filters out so regularly. We had changed the filter, and it's mind you, it's a 12-hour shift. But here we are not even halfway into the shift, maybe almost 5.5 hours, close to 6 hours, and we've
Mm-hmm.
already changed this filter about 4 times, almost
Wow.
getting ready to go on the fifth time, just so the patient can breathe adequately. So I kept complaining. I complained to higher ups, and I said, I don't think that these are efficient enough for the patients to be ventilated. Maybe we need to try. Do you have any other real ventilators that are the kind that can take, the stand the test of time here, because we're changing out the filters and we're complaining already about not having enough stuff. So what are we gonna do? So I was brushed off, like I didn't say anything, it didn't mean anything. So finally, that one patient that I complained about 3 to 4, almost 5 days in a row, finally coded. And I was the person that that patient coded on. And the reason why he coded, because he had labored so hard and he already had heart issues. So it was easy to just get tired, and he went pulseless. So I just happened to be at the bedside when it happened. And so I end up getting him back, calling a code, doing a round of medication, trying to get him back. And it wasn't hard to get him back because I was right there.
Right.
But
But
mind
you're
you, if I had been away with that ventilator screaming like that, I didn't feel comfortable leaving his bedside. Just thank God I only
you're
had
saying
that.
the outcome would have been different had you not been
Thank
there.
you. If I had
Right.
not been there, it would have been different. You
Now,
know.
sis, I was watching the video that white nurse did in that that video that I just showed there.
Mm-hmm.
I didn't really show the entire. I just
Mm-hmm.
But I was listening to what she was saying, and you were saying pretty much everything that nurse was saying. You were talking about them running some tube inside of the room, and they're
Mm-hmm.
not really going in the room to
Mm-hmm.
assess the patients.
Mm-hmm.
So is it fair to say that there hasn't been much changes or any changes at all since the last time we spoke in regards to what's going on in the hospitals?
No, it's not. It's no changes, because they still have the pumps, the lines running outside of the rooms. And so, I don't, the ones that I do, I kind of put them in the room because I want to go in there and I want to see my patient. I want to make sure that I'm seeing everything, because it's easy to hang a bag of fluid. It's easy to scan and do this on the outside. But my assessment of what's going on is to make sure that the patient isn't, going to tank on me,
Right.
so that's the reason why I rather go in to look, because if I mind you, if I had a did that method on this particular patient, I would have lost him. He would have been gone, because what's sad about it is this particular ventilator had the guy sitting at 98%, and he was pulseless for a nano of a second, because I was standing there. I was actually doing my morning assessment of him, and I'm like, wait a minute, this don't look right. So then that's when I went to checking pulses, and I didn't get anything. I was looking at the monitor, and it was like just standing there at, how could you be 98%? And you're intubated, and this is going at the same time. So I'm
Right.
like, it didn't make sense. So with those particular beds, they were able to put you in a position to do CPR. I'm starting to do CPR now
Uh,
to get him back to life, so that he would not have that moment without circulation. It's
right.
just, and then that's when they decided to listen to what I said, and they actually got a real ventilator and put it in there. I was like, wow,
Wow.
why didn't y'all do this at first?
So
But
imagine that's probably going on everywhere else.
thank you. Yes,
Mm-hmm.
it is because
Yeah.
that whole unit have those types. I hadn't seen but that one, but that if that person hadn't a coded, they wouldn't have that ventilator. So where did you get that one? Why can't we use that for all of them?
Hmm. Sis, I got a question for you.
Mm-hmm.
Now, I got a question for you.
Sure.
Based on your experience, right?
Mm-hmm.
Um, and you've been working, I know you tired, girl. Based on your experience and what's going on in the hospitals, right? Because you've been to a few different locations.
Mm-hmm.
Um, can you tell us what you believe is killing these people in these hospitals? Do you know? I mean, you don't have to answer if you don't want to, but do you have any idea what's killing people in these hospitals?
For one thing, is you're coming in with one thing and you're being treated for something else. You're being labeled. In other words, everybody's COVID, regardless what they're coming for. But now, if you don't have the proper equipment along with trying to, okay, it's just like me bootlegging to give you some air. It's going to be difficult for me to give you air if and to make sure that you're, getting proper oxygenation if I'm first of all not being in the room with you, if I'm not paying attention to what's going on, if all I got is a monitor, because what proof in the pudding for me was you can't just look at these monitors. Because remember, my guy was pulseless and he was at 98%. How could you be 98% and your heart rate is down to
Mm,
5? You went all the way from 90 to 45 beats per minute. And if I don't
yeah,
to stop that, you're gone. So here I am hanging pressors and things to help, put get that back up. So I think the lack of attention and the fact that even the nurses, even the doctors, they don't even want to go up in there. They're asking us for stuff.
so
You
you're
know,
saying it's mostly neglect that are killing the
yes,
patient.
yes, because the issues that they're coming in with has nothing to do. COVID is, I'm gonna tell you like this. That's just the way I look at it. It's just a name that they made up. And when how can you treat something that really existed under another name? Like
Mm,
if you come in and you have ARS, which is acute respiratory distress syndrome, okay, that's something that people have all the time. That's not new.
right,
The flu is not new. Pneumonia is not new. These things have taken people out on a mega scale anyway, especially if they're immunocompromised or have something going on, COPD or asthmatics. It just depends on how well you take care of yourself in that situation. You can't smoke all your life and expect to breathe, the best of you can be. You can't eat everything in the book and come in obese and expect us to do a miracle overnight. We have to work together as a team, to try to get those things under subjection. So I think it's the neglect because if your
right,
pumps are on the outside of the rooms, and if you're on the outside, how can you be on the inside? But what's getting me is the fact that they're saying that we're just running over, pressed down. No, it's not. There are empty beds. There are people that are going to the floor.
hmm,
So how, if you were COVID to start with, where's your quarantine moment?
mm,
Okay, how are you going to, just like with the nursing home situation, how are you going to send that person back? How is that quarantine? Because most nursing home got somebody that's in the same room beside them.
right.
So how are you going to quarantine that person? It's just not happening.
Something is
Like,
not right here. So either they're,
thank you.
if whatever they're giving these people, and this is not your words. I don't want y'all to. These are my words now. Sister Sally didn't say it. This is my word. But if you're whatever y'all are giving people in the hospital, you're sending the patient back into the nursing home or wherever they come from with whatever it is that you just gave them, because you're labeling somebody COVID and then you're sending them back to the nursing home where there are other patients in the nursing home. So whatever you just gave that patient, you're sending them back to give the entire nursing home what you just gave the patient, right? To spread it all over the place.
Which is bring me to my next delusion is, hey, look, you don't have it to start with. You can't. But how could you?
So is it
Where's the test? You got a swab, which a swab test basically determining. It's almost like the Tuskegee situation all over again. You know,
Mhm.
how can you swab? And even the doctors have said there it's not a way to diagnose it. All it does is pick up the antibodies. If you have been somewhere, like say instance you had the flu or you recently had it, it will pick up, and sometimes that don't even work.
But sis, I don't know if you were watched there's a doctor.
Uh,
He's been a doctor, I believe, for 33 years. I don't remember his name, but he's all over social media now because he's speaking out against this. But he says that if you have gotten the flu vaccine, you will be tested a false positive for
exact,
uh,
ex-
the COVID virus. Have you heard that?
yeah, that's true. Because COVID is flu. It is pneumonia. It's a different strand of the combination put together. It's the same stuff. You can go if you become sick and you know how to treat yourself well with herbs and with just natural good things, and you're taking care of your body, you can I mean, come on, because we even had people that I know they got this new thing called proning that they doing now. They're flipping the people on their faces, and that which is supposed to help them to, breathe better, and it's supposed to reverse what's going on in the lungs to the point
Uh,
where they can actually breathe, but they're still intubated, but they're just, prone for 16 hours at a time.
really?
Yeah. Yeah.
Is that a protocol? What?
It's their new protocol that they got out. That's what they're doing.
Now, see,
And
I'm no nurse, sis, but is that good?
no, no, because like some people,
God damn.
I'm gonna tell you like this: there are some situations that we ran into where people have had skin breakdown from it. Because just think about it. If you're prone, you're there for 16 hours. If you're on your butt, we turn you every 2 hours.
Right.
Okay, so now that's creating another havoc, but nobody's addressing it, but it's there.
My God. Okay, sis. So you and I talked, right? And I
Mhm,
wanted you to tell us about the particular. Now, you ain't got to go into details that's gonna, compromise your situation, right?
mhm,
But we spoke about a patient that was brought in on one particular date,
mhm,
and the paperwork for that patient was manipulated somehow, and somehow they were um, uh, 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 you know, uh, uh, labeled a
mm.
COVID patient. Do you remember we had that conversation?
Yes, I
Can
remember.
you? Would
Wait,
you like to elaborate on that for
I
us?
really would, and that would be my last elaboration on that too, because it's the God honest truth. Here's what happened.
Okay.
I'm known for always. I come early and I always look to see who I have, where I'm gonna be, because I want to know what my plan. I got to get my plan together because it's a 12-hour shift. We got to get it together. So I was just happened to be looking through the admission process, and I thought, wow. I said, so this patient was at home basically. This patient was at home, went to the doctor's office for a regular visit. That didn't seem to go bad. And what got me was the patient was not at either the doctor's office or the hospital, and they were on the record, and I thought it was just an error. So I just kind of overlooked the first little area where it says patient was diagnosed COVID positive on 4/1. So I said, okay, well, that's reasonable. And I didn't think nothing of it. So I kept reading. Then it said the patient was admitted to the hospital for 11. And I'm like, wait a minute. How did you so I said, well, maybe it's a typo error. So I kept reading and kept reading and kept reading, looking at other different things. And then it turned around and said it again. It said patient diagnosed, and it had 4/1 again.
So let me let me
Well,
let me try and see if I can reiterate what it is that you just said. So
yeah,
what you just said is that a patient come into the hospital on, let's just say on the 10th of the month, right?
right.
And they're in the hospital. They came in on the 10th, but you look at the patient paperwork, and the paperwork is saying that the person came in on the 2nd or the 1st,
Mm-hmm.
and which is wrong because the patient just came in on the 10th. And not
Exactly.
only did they falsify the paperwork of that patient, they and manipulate the date. They also put on the patient's paperwork that the patient is a COVID-19 patient, and the patient was not.
Not even in the hospital.
Yeah.
And
Wow.
the sad part about it is it was documented 3 different times. So
Right.
I thought, because I was thinking, well, maybe they meant the 11, but the patient actually came in, and the patient came in on what, 10 days later? So
Right.
so you can't mistake a zero. You know what I'm
So
saying?
you so the long story short is you have medical staff that are manipulating the patient's charts and paperwork. And so the reason I wanted you to elaborate on that a little bit is just to for the people who's having any doubt about
Mhm,
what you guys that are right there in the midst of all this chaos, right?
mhm,
Asking for proof. I'm just trying to figure out if you have the medical people, the so-called professional in these hospitals that are manipulating paperwork, what kind of proof you're going to have? What kind of proof you're going to have? If these are the same people who are manipulating paperworks and switching up dates and putting the wrong thing on patients' paperwork, where are you going to get your proof from?
And the thing is the patient came from home. I can see if they came from the doctor's office. I can see if they, because technically most right workups will say something like patient came in from doctor's office because referred for blah blah blah. But it was nothing like that. It's like patient came from home, and
Right,
patient complained, aka 2 to 3 weeks prior to that, of feeling just tired. You know, well, I'm gonna tell you like this: I had an iron deficiency, and I was tired.
right.
But
Yeah.
then I got blood work, and it proved it on my hemoglobin
And
levels. You
so,
see? So
listen, that's another problem. People are just walking into the hospital complaining about dumb crap. I'm tired. My eyes hurt or some foolishness.
like I told you the last clip, I worked in another area where a person actually came in and was saying that they was feeling scratchy at the throat, and they was feeling something like some kind of way in the throat. And I'm like, okay, well, 9 times out of 10, you probably just came to the ER for nothing, because, like I said, I work between ER and ICU, and that particular time I was floated over to the ER, and so I was like, well, sir, what you need to do is probably go home and get you some warm tea and treat it just like you would a common cold. I
Right.
said, plus, stop sleeping under the fan. I said, because I do it. So if you sleep under the fan, you can expect to feel some type of way after a certain
Hmm.
period. And so he said, how did you know? I said, because everybody does it. We see people like that all the time. So he left. He didn't have to stay. He didn't have to stay. But now, mind you, other people that have came, they didn't leave out so easy. You
Hmm.
know, they didn't leave out so easy. They was eventually just sent over to ICU, in some type of way. maybe not that day, but maybe a few days later, intubated, and then you put on these sedatives, and if a person is sedated, how are they going to tell you what's going on? And,
Exactly.
and like I said, I've seen people sedated with no evidence of why we sedated this person.
Mm,
What are we doing? They're just like with the nursing home character. I'm like, okay, we put an NG tube in. Reason why they went to X-ray in the first place was to get placement verification. Not that he's short of. It's no signs of.
now, could you,
Oh,
sis, could you explain? There might be one person on this live who don't understand what sedation is. Can you explain that in just plain English?
okay, so you know how when you're gonna go to, let's just say you're gonna go to
Under
have
surgery, and they put you like
a
an
minor surgery.
anesthesia, give you anesthesia, and
Yeah, you're
you
gonna be put
and you
on a
fall asleep. Right.
exactly. And what they're doing, you got the anesthesiologist there doing that. But in the ICU areas, we have different forms of sedative that is used. And some are not as intense as others. Like I'll use example like Presidex. You can be under anesthetic called, Presidex, and it don't put you completely out, you know your max out is 1.5, but however you can have that and still be able to kind of shake up out of it,
Mm,
because I've seen patients do it. But now if you combine it with that, and maybe let's say you put some ketamine, okay, now that's going to help with the heart and everything else, but it's going to, as I heard them always say, they feel real good.
mm.
Hate to say it like that, but that's
So,
the way it is.
are you saying that patients are being sedated
Yeah.
that are not supposed to be sedated?
Like for instance, I had a situation where the first, okay, on one particular provider.
Give me 1 second, sis. Hold your thought there
Okay.
for a second.
Okay.
Um, I don't know how many people we have in the house, but can y'all hit the like button? Come on, man. We got the listen. Sister Sally worked all night last night. She came home this morning, right? And she haven't even gotten sleep yet. Seriously. She's been up, right? And y'all are here listening to Sister Sally because she's love y'all so much that she's coming to give y'all some information. And the least you can do, for God's sake, is just to hit the like button. Seriously, seriously. Is it that hard to hit the like button? 38 like, and we got like almost 100 people in the house. At least that's what I'm looking at here. Can y'all just hit the like button? Seriously. Okay. All right, Sister Sally, I'm sorry about that. Go ahead, girl.
That's okay. Like I said, with this one particular situation, they was like, well, we want him to wake up. We want him to wake up. I'm like, oh, good. I was excited because I'm like, I want him to wake up too because I want to see what kind of person this person is. And just when they swapped out providers, and the other provider came and said, no, we don't want him to wake up. He started waking up and start pulling lines and just, doing all kind of stuff. And, I'm trying to redirect and say, hey, look, you're in the hospital. Everything is okay. Don't pull this out, don't pull that out, just calm down. We're going to discuss everything and give you an understanding of what's going on. The doctor comes in and say at the door and say, no, I want you to turn this up, this particular medication, this sedative, turn it up so that he can rest. I'm like,
Whoa.
I'm confused at this point because why are we making him go back after we said the other provider said that they wanted this particular patient awake and alert?
Hmm.
Because the guy was getting ready to the guy that was coming around, he was getting ready to he pulled out the line. They have different lines that we run for fluids to come into the body and everything, like IV sites, and
Mm-hmm.
he was pulling those things out. He was even going to reach for the Foley. And I'm like, no, don't do that. I was just trying to redirect him because I figured he was confused. He didn't know, you've been out for what? however many days you've been there, you don't
Right.
know what's going on. So, you have to redirect them and let them know what's
And
what.
this whole time, the family members are not there to advocate for their family
No,
members.
as a matter of fact, let's deal with that too.
Well,
Um,
we
this
were gonna
is
come. We were gonna come to that. The family members.
this is strict policy.
Mhm.
Nobody comes to visit. Even if they call, they have to. The nurse cannot give out information. Basically, it has to be the provider.
So you're telling us that you have patients in the hospitals that are being neglected
Mm.
by so-called medical professionals, right? And the family members are completely cut off from their patient, the families in the hospital. So
That's
there's
correct.
no one there to advocate for the patient.
That's correct. And you also have family members that know other healthcare workers that try to get them to come by to check, and they will stop them at the door. No, we're not allowed to do that. We also had a situation where somebody snuck an iPad in
Hmm.
and
So,
they was trying to watch the family member from home.
wow. Let me ask you, sis. What rights does the patient's family have?
Well, you have a power of attorney. That person has every right to know
Well,
what's
I
going
mean,
on.
like the patients with COVID-19, they're in the hospitals, they're whatever. While they're there being treated for this so-called COVID, what rights does the family have? You know,
Well, oh, from that perspective, none. Because you're not allowed to come out on the units because of the situation. Remember, they have the 6 feet thing going
yes,
where, okay, and you're not allowed to come. They even have people guarding the entrances. You if you're not wearing a badge and a uniform, you got to stop at the desk and talk to them, and they have to approve for you for whatever reason, whether you're coming to be checked in or whether you don't have access. Only people that are allowed to come in at one particular facility that I was at was the patient died. And that's when the family was called to come in. The patient was dead.
wow, wow. I, I have another question for you, Sister Sally. Wow. Uh, can the family of the patients uh, participate in the decision regarding putting a patient on ventilation?
From that standpoint, that's going to be difficult to answer. And I'm going to tell you why. Because we're not able to, as nurses, participate in that aspect of it anymore due to the fact that the family gets 5 minutes a day communication with the provider.
What? I'm sorry.
Yes. So, you know, whatever the provider is telling the family, all we can do is go and read in the chart and say, okay, well, this is what, has been ordered and blah, blah, blah. It's just like that's what we do. We take orders. And if we get something that's questionable, we go to the provider and say, hey, look, are you sure about that? Because I'm not gonna, I've done that. I've said I'm not gonna be able to give that because that's not gonna be fit for that patient, you know. And then that's when they'll converse back with you. But as far as what they said to them, only thing we can do is go and read what they put in the notes. I don't know physically,
So,
verbally.
so the patient's family have no decision at all in regards to the patient being put on these ventilators.
The only way they can make a decision is based off what the provider is telling them.
Right. And the provider
That's
is
it.
a piece of SHI, you know what.
I got you. You're right. You're right. And
And
what's
the
sad about
families
it,
have 5 minutes. They have no access to their family
five
members in the hospital, and they only have 5 minutes to speak to the so-called provider.
5 minutes. because they claim that they have so many patients and it's only a limited time that they have. And then they deal 5 minutes a day.
Man, I'm speechless. I got another question for you, Sister Sally. I'm
Mhm.
wow. What is the recovery rate, would you say, of patients on these ventilators?
Those particular ventilators are not, like I said, they're not long term ventilators. I don't know where they've been keeping them. I don't know where they get them from. Like I said, I've seen them, but with transporters, for a temporary, like maybe 2 hours, 2 to 3 hours, or something like that. It's not for a long term. This is the first couple of areas that I went to that I noticed that they had them. I haven't seen them anywhere else like that.
Right.
And the ones that I have experienced in other areas, even out in the West, they're the actual ventilators. So I don't know where they're getting those from, but it's not adequate for long-term use. Now, like I said, it was a situation where a gentleman came in from home, age 92, 93-ish, and he came to because it was just his time, but he was labeled, I'm sorry, but he was labeled COVID on the death certificate, and the man never was tested. He was already they was already resuscitating from home, and so how could you say it's natural causes but it's COVID at the same time? I'm confused on that note. Yeah. So like I said, it's a lot that don't make sense, but I haven't read a chart yet that justifies COVID. It's just not justifiable. It's COVID to me is just like having the flu, or maybe pneumonia from aspiration, maybe, or just from other causes.
So from what you're saying right now, I could be wrong. From what I'm taking away from what you're saying, right? So people are dying because of number one, the neglect.
Mm-mm.
Number two, they're coming in with one thing, but they're being treated for something else, which means that the treatment that they're being given does not coincide with what it is that they really are suffering from. So that's obviously going to compromise a person's health and kill them faster. If I have, you know, if I have a, I don't know, hypertension, and you're putting a damn ventilator on me, and I can't, whatever, and something is restricting and you're giving me anesthesia. I'm being knocked out, or if I have asthma and then you're putting me to sleep, like it's the treatment that the patients are getting that doesn't have anything to do with the illness that they have, and that's what's pretty much killing a lot of these people. And that along with the neglect.
Yes. And then you kind of get up under fire when you ask a provider, hey, look, you're addressing all these other issues that I'm not seeing evidence of, but why are we not addressing, let's just say, for example, why are you not addressing the main thing on their diagnosis, which is hypertension? Why are we not dealing with that? You know, why? Well, that's my fault. I had one provider to tell me, well, that's my fault. I should have addressed that. Okay, so what are we going to do about it now?
Man.
So I've been under fire for asking questions about
Well,
stuff because
sis,
it was out of order, and I'm like, well,
sis, you might want to stop asking questions because we need you to out of it. We need you to come home, sis. Come on now. You don't ask too much question now, Sister Esau, because uh we
you're
need
right.
you alive, sis. Please don't ask Esau too much question. Now you might starting to become that one uh, uh, outdoor Negro who's asking too much question.
Yeah, but you know
Feel
one
you
thing
might be
about,
the real Negro, sis. You know.
yeah, and you know what, sis, I'm gonna tell you, I have always been an advocate for my patient. And when you can't
Well,
speak
that's
for
what you.
yourself, that's
That's
what I do.
right.
So I'm wanting to know, why are we doing this? And if you ask me to do something, it is beyond the protocol and it's not within the line of what needs to be done. I have went so far as to tell the provider, okay, well, if this is going to happen, you're going to have to go in there and do that because that's out of my scope of practice.
Right.
If it's
So
not right, it's out of my scope of practice.
exactly. So you're not really you're not really sure. You're not really sure what the recovery rate of patients that are being put on these ventilators. You don't know, like, are they dying faster? Are they recovering?
Well, I hadn't seen people just. I don't think that they're dying from COVID. I think that if when people leave, I hadn't seen people leave like just die off like that. Usually they have several comorbidities that takes them out. It's nothing to do with what's going on. That's why I said it's the standard. It's not a new, like, let's say if I went in and the whole unit was wiped out and the nurses passed out, the doctors passed out, or we was constantly getting new people and they was constantly getting sick. Okay, well, that would make sense,
right.
to say that, okay, this thing is terrible. When you, I mean, people should wake up. What is it going to take? Take your head out of the sand and look around the street. Do you see the people passing out? Do you see anybody just dropping dead on the
No,
street?
ma'am. But we've been hearing that these ventilators are killing people in the hospital.
That's exactly right. Because if you're not having the proper ventilator, it will. It can produce a lot of havoc, and you just can't. Then they get dependent on it. And then now you want to send them to another unit to wean them off of it because you've done all we can do there. So I thought you said that they was COVID. What, at what period are you no longer labeled something that you really wasn't when you came in the first place?
Hmm.
If you bring me into a COVID unit, well, why would you send me to another unit that's not COVID?
Mm.
But I'm still on the ventilator
Right.
because
Mm.
I have a dependent to the ventilator. But like I said, as far as I hadn't seen as what I have seen on some eras of YouTube where they showing where people standing all outside with dead bodies and this thing and that thing. I mean, the average people that are dying are just people dying. It's their time. That's what I'm seeing. I'm not seeing like a massive number of people just dropping off
And
dead.
you're in the heart of this thing.
Yes,
I ain't gonna say where you are, but you are in the heart of it. You ain't in some
I'm
little
in the
small
very heart
town
of it.
out in the
When
country somewhere. You're in the heart of this madness.
uh, exactly. And when it
Yes,
first
ma'am.
broke out, here I was, and I still didn't see what they saw. You know,
Mm.
I didn't see all the stuff that they were showing on YouTube. That's why I was like, okay, you can't believe what people say like that. And like people want evidence. Well, let me tell you something. If you're looking at a YouTube clip and you see somebody outside with some dead bodies, those are actors. Come on, stop it. Those are sheer actors because that would be what they call a HIPAA violation. When can you put a body on the outside? When is okay with a family member that you load them up on an 18-wheeler?
Now, sis, I've worked at a major city hospital in New York City, right? And I have been in the morgue more times than I can count. Okay, I've I've watched bodies get diced. I mean, I ain't. But anyway, I know that there is an area to the morgue where if there's anybody that's going to leave the morgue, there's a huge area at every hospital. It's very private, where any vehicle that is coming in there for the bodies has to come to that area, and it's very private. It's you ain't gonna see no bodies being thrown down around the hospital where the public can see it. I have never seen that. Every hospital has an area where the you know where the whoever is coming for the body, they come for it. There's an exit door. They come in, and I have released more bodies than I can say. I have personally released a lot of bodies working in these hospitals. I can tell you that right now. And so I know how these hospitals are set up. Okay. I've never seen nobody them thrown down all over the place in front of the hospital where people can take pictures. So I believe you when you say a lot of this is just people acting.
Mm-hmm. Exactly. Because we actually put them in a, I mean, once we clean them up and the family comes and see and whatever, the doctor does his thing, pronounce it and whatever. And then, then the family can come. It makes no sense. Why would you allow the family to come then? Why couldn't they come before
Right.
then? If it's
Right.
COVID,
Exactly.
why would you come at all? I've heard some people say that they weren't even able to give their parent a proper burial because it was COVID. Okay,
Mm,
so that's not what I'm seeing. I'm seeing that it's okay to come out there when they're dead. That's not good. But
really?
once we do what we have to do, the patient don't just leave off the unit without being tagged or in a bag. We clean
Right.
them up. You got a body bag for that. And then you take them to the morgue, and the funeral home does the rest. Whatever
Mhm.
funeral home that they're gonna go to.
Sis, have you treated a lot of patients that are on ventilators?
Yes.
You have.
Mm-hmm.
Now,
Trach ventilated. You know,
what is? Can you explain to us what trach is?
a trach is like an artificial airway that is because of the patient having difficulty breathing. They would, and they're gonna intubate, like put, where they trach them and they hook them up to the vent
Right.
basically, and the vent does the work for them, and they have cuffs, which is inflated, cuffs and everything that put in there. That's might be a little bit, complex for some people to understand, but it helps with the airway opening
Airway. Yeah.
so that they can breathe. You're right, so that they can breathe. Because the ventilator is doing the work. That's why they have these settings on it. But it has to be a appropriate type ventilator. Yeah, it's okay for temporary use for a little box, as I would call it, about the size of the largest iPad. But for a long term, that's not good. So to be trached is a artificial airway that's put in, and usually we have what we call those. We call them shallies. We'll have like, the inner cannula that goes in to help keep the airway open. For the air to go into and so we interchangeably change that out, and they have what they call trach ties that help holds it in place.
Right.
And
Right.
so mainly respiratory is supposed to do that. And that was my next chief complaint, because it seems like to me that they don't even have a job. You barely see them.
Right. It's supposed to
It's
call
like,
somebody from the respiratory department to come down and do that type of stuff. Right.
but it's not that they're doing it during this whole crisis, because they were saying that, well, even though you got an open system and a closed system, they had basically closed system, but they still didn't want to come to do that because they said they had so many patients that they couldn't do them all.
But that's what that white nurse was saying is that you have medical staff that are now doing stuff that they normally wouldn't do because it's not their job.
Exactly.
Everybody has their own job, and so now you're thrown into the thrust of things, and you're
Exactly.
pretty much just left on your own to figure stuff out on your own. And that's why,
Exactly.
again, that's why these people are dying.
Exactly. Because
Would you say
everybody don't know how to work with a ventilator, Angela. They don't.
right? Now let me ask you a question, sis. Now you don't have to answer this. You don't have to answer this if you don't want to. But have you seen a lot of black folks? I probably asked you this the last time, but in your works every day, right? Have you seen a lot of Black folks coming in and going
No,
to put on these units?
no. I've seen two. I ran across two in the whole time. And I promise you, they did not come from home. They came from a home, like a nursing
A nursing home,
home.
right?
Exactly.
So you're not
I
seeing any young Black people, like young Black man, young Black woman? No, none of that?
I haven't seen. I've seen Latinos, you know, and look like some Indians, but not just no. Mm-mm. Hmm.
So where are we getting that this thing is killing off a whole bunch of Black folks?
I don't know. That seemed to be fabricated to me because I haven't seen it, and I've been west and east and south, and I haven't seen it.
Okay. Wow. All right, sis. Man, I don't want to keep you too long. I know you have to go to bed. I know you haven't slept,
Okay.
and I'm trying not to keep you too long. All right, we've been on here for 1 hour and 10 minutes, so I don't want to keep you. Feel free. This channel is open, to you. If you ever decide that you want to come back on and tell some more of what it is that you're, experiencing in this
Yeah.
hellhole, you are welcome on here again, Sister Sally.
Thank
And I
you.
really appreciate you coming on here, taking some time off. Before you go, I wanted to come bring you some stuff because I had sent you some stuff in the mail, and you didn't get it. Somebody stole it.
It's okay.
So I wanted to bring it to you myself. So hopefully next weekend I'm able to drive it out there and come give it to you. Okay, sis?
Okay. Thank you.
Yes, yes. All right. So do you would you like to come back on, sis, one of these days? And if so, when would you like to come back on and just touch base with us on on the platform here?
I will leave it open to you, sweetie. You just let me know, and I will be glad to assist because I'm quite sure every time we don't talk or I don't see, it's always something different that, is popping up,
Right.
Like I said, people they're not just rolling people out, Like I said, these ICUs and ERs are not as full as people trying to maintain that they are. It's
Yeah.
not. I mean, standard everyday thing that you would get, from just people having situations going on and not knowing how to deal with it at home. But like I said, the mislabeling is to me to just it's like a certain amount of numbers of something that they're trying to generate to prove that okay, this is really real, and it's a
Right.
fear factor because now they're talking about opening up different areas and stuff like that, and then people are actually afraid now to go outside. They're
Yeah.
afraid to take
Yeah.
off the
Yeah.
mask.
Yeah. They have gotten to the people.
How is your body gonna fight against something when you're not exposing your okay, so
Exposed to, yeah.
exactly.
Yeah. Yeah.
Because the body is amazing.
Yeah, of course. Yeah. Mm-hmm. Yeah, sis, we know. We trust me. We already see the nonsense. We already see the nonsense. Now
People
I
ride
know
around
you.
their cars with masks. You had one guy, he literally passed out because he wasn't getting enough O2, and it was the CO2 that he was getting too much of. He passed out. He
Oh
had to take
wow.
the mask off because you're overdoing it.
Wow. Yeah. Yeah. Sis, I know your schedule is a little crazy.
Hmm.
So we'll bring you back on here. Depending on how your schedule, because my schedule is crazy during the week, and I know your schedule is crazy. So we can only do this on the weekend.
Okay.
Yeah, but I know your schedule is a little crazy, so
Fine.
we will I'll touch base with you and we'll figure out when we can have you back on again so you can just give us another update on what's going on. All right?
Okay. Yes, ma'am.
Yeah. So thank you, sis. I appreciate it. I do
You're welcome.
appreciate you taking the time out to talk to us today. Appreciate it.
You're
Thank
welcome.
you.
You're welcome. You're
Get you
welcome.
some sleep, sis.
Okay. You have a
Get some
blessed
sleep.
day.
You too, sis. Thank you.
Yes, ma'am.
All right, we'll talk.
All right.
Bye. All right, guys. Somebody said their brother Dante. You said your mom is in the hospital. I'm so sorry to hear that, brother. Wow. Did they label her too? Everybody's being labeled. Did they label the poor woman with the COVID? And they won't let you go and see her. Yeah. Yeah, they're preying on the elderlies. The elderly, they're preying on the elderly. They're trying to get rid of the elderly and the weak, the weak-minded. That's what they're doing. And it's working. The people are pretty much been programmed now. They don't want to go outside. I'm sitting outside yesterday in my car, and about 90% of the cars that drive past me, there's one person sitting in the car and they're wearing a mask. And I'm like, you're alone in your vehicle and you're wearing a mask? You're driving alone in your vehicle. Why are you wearing a mask? What are you trying to not to give the car the corona, or are you trying not to get corona from your vehicle? Like, I'm trying to understand what's going on. Why are we driving around in our vehicle with a mask on, all alone by ourselves in our car, and we got a mask on our face? What is this? So, and this is the majority of the people that I see are black folks. So they have pretty much gotten to our people. We're right now, if they say come line up, we're gonna be injecting everybody with the cure. I guarantee you 90% of our people will be right there in line, because our people have now been pretty much been programmed with this whole thing. But anyway, I don't want to stay on here for too long. I'll thank you to Sister Sally for coming on here again, and I'll talk to you guys later. Thank you guys for watching, and thank you for hitting the like button. I appreciate that. Do appreciate that. All right, guys. Love you guys. I will talk to you later. Shalom, everybody. Hey, Sister Heavenly.